Hello, my name's Andrew Barton and I'm a nurse consultant in vascular access IV therapy, and I also am the chair of the National Infusion and Vascular Access Society of the UK. And we're here today to talk to a patient called Karen who's had a journey through vascular access and oncology with chemotherapy. The point of today is to really explore Karen's journey and how vascular access and vascular access services have impacted her on that journey. So NIVAS is a national organisation in the UK that aims to represent practice associated with IV therapy and vascular access, and we are there to represent at a national level Department of Health, NHS England, MHRA, NICE, etc. So I'm going to hand over to Karen, introduce you to Karen now.
Hello, so my name's Karen. I am firstly a patient of Andrew's, but I also have the pleasure of working alongside Andrew in the same organisation.
So Karen, welcome. Can you talk to me about your experiences of vascular access and your kind of your, I know because you've had some journeys through cancer. So could you tell me about your first sort of experiences through that?
So my first experience, I sort of go back to 1999, Andrew, when I was diagnosed with breast cancer, and part of that journey was chemotherapy following surgery, and it was really, I'm not even sure if we had vascular extended vascular access then, so all my chemotherapy every 3 weeks was put through a cannula that was in my hand, and it, you know, I just remember it being really painful, really uncomfortable. I dreaded going to the oncology unit to have my chemotherapy. It was just really quite awful, not the best experience at all, but I know I need to have the chemotherapy.
Sure. So since obviously you had that first episode of breast cancer, after that episode, did anyone ever explain to you that you may have difficult IV access in the future?
No, I think it was, I suppose in a way I just got on with my life and anticipated that if I ever needed further procedures or was ever sick, that they would just continue to try access on that arm.
Sure.
So no, I can't remember sitting down with anyone, and it was just not part of the process or the roadmap.
Yeah, and you don't remember there being sort of a vascular access team at that point to help you? Okay, sure. So it's quite interesting because in now, where we are now in clinical practice, difficult IV access is obviously more on the agenda, and the term difficult IV access patient is something that is a bit more recognised now, and I think you would fit into that category. And we have pathways now for difficult IV access patients. And it's true to say that, you know, at least 50% of patients that have peripheral cannulas placed in hospitals will potentially fail before the end of the intended IV therapy. So it's a big problem. So can you think of a time then, since you had the breast cancer and you had your successful treatment for that, were there any times when you had bad experiences with peripheral cannulation?
So I remember I'd gone to the States for my 50th birthday, and I remember flying back, and for some reason I ended up with cellulitis on my right arm. So I presented to the emergency department, and one of the consultants gained access, but it was really limited, Andrew. It was sort of like in tiny, tiny little veins, sort of on the back of my hand, in between my fingers, and I needed my IV antibiotics, but it was so debilitating, as in it was painful, uncomfortable. I was limited in how much I could use my hand at that point, and it just felt all stressful and anxiety, and and I suppose even at that point I wasn't aware of what was available to me.
Yeah, sure. And when that happened, at the time, were the doctors and nurses aware that you had difficult veins?
I told them.
You told them?
Yeah, I told them.
And what was the response from them?
I think the theme around it is always, we'll get access. I'm good at getting access. We'll continue to try, and it's all about peripheral cannulation. There was never it wasn't entertained about doing something different.
And do you remember how many times they attempted?
Quite a few, probably a handful. Sometimes it's a number of staff that would come and attempt.
Yeah. And how, obviously, was that painful?
Very
painful.
Yeah, and I think with each time that they cannulate, there's your fear, anxiety factor goes up another level, and the fear is always, and they're going to say, we need to try and cannulate your right arm, which I know they evidence at the time was that that's not what they should be doing.
Because of the risk of lymphedema, sure. Then we've kind of a bit more recently, you had a journey through cancer again, unfortunately. Can you tell me a bit more about that?
Yeah, so in May last year, I presented to the emergency department with obstructive jaundice, and I think probably somewhere in the back of my brain I knew that it wasn't going to be a simple journey. Again, in the back of my brain it was like, they need to do blood tests, I need access, so it was this sort of like, this is the start of the journey, and I was, after much investigation, I was diagnosed with stage 1 ampullary vata cancer. I've been successfully operated on, curative surgery, but part of that was chemotherapy, which, Andrew, honestly, when they mentioned to me mop-up chemotherapy, the first thing that came into my brain was, and what does that mean around access and cannulas and pain and discomfort and all of those things. So, but I knew that it would be, I needed to have the chemotherapy.
Yeah, so I guess your experience from your last journey with cancer and having chemotherapy, your anxiety must have been quite high just around what you needed for vascular access. And so at that time, not that long ago really, were you aware of the vascular access team?
So I think I was certainly by this point aware of the vascular access team, but on a professional level, not on a personal level. And I suppose I wasn't aware of the service that we provide in the organisation that we both work in, and I now became a patient in. So it was on my radar, but I was a patient, so I don't think I was in a place to reach out. I wasn't advocating for myself in that way.
Sure. So your first experience of the vascular access team, when did that happen?
I think it happened, I hadn't been in very long, and they visited and shared with me as a patient the benefits, the risks, what it would mean for me, not in too much detail because I don't think I was absorbing a huge amount at that point with also the diagnosis, but just how much easier it would be to have a different form of access and what that would mean moving forward.
Sure. So I think at that time they had recommended a PICC line for you, is that right?
Yes.
So tell me a little bit about how the PICC line went for you.
So I remember it being it was probably a bigger procedure than I first thought. This is my first sort of like experience of as a patient having a PICC line. It was explained to me. I'm sure I consented, all of those things, and then I think it was the gowned up, sterile field, and the care and consideration given when the nurse was placing the PICC line was outstanding, exceptional care. And I think for me what was really the end point was, once this is in my arm, then all that relief of, and they're now not going to put a cannula in me or try and put a cannula in me when they need bloods or to give me drugs, was just like the overriding sort of like,
Sure.
But it wasn't painful.
Yeah.
I felt some pushing, but it wasn't distressing in any way.
Okay. And whereabouts did it go?
I think it was here, Andrew. I think I had it
in your left
just
upper
under here.
arm.
Yeah.
Sure. So once they'd put the PICC line in, what treatment did you have?
I think at that point I was having fluids and some anti-sickness medication, and I think also some antibiotics, and they all went through that one line. I remember the nursing staff and the vascular access team visiting me very frequently, ensuring that the site was clean and safe and accessible and patent. So it was very focused.
Great. Do you know what I mean by the term extravasation?
So if I as a nurse, yes, it's something that I'm aware of. I probably don't understand. I think as a patient, I was focused on these are the things that I need, but my extravasation when I first had chemotherapy, I think could have happened because I did have such an irritant in my veins.
Yeah. And have you ever had an experience with extravasation before
No.
then? Okay. So how long did the PICC line stay in for?
I think I had it removed just prior to leaving hospital that first time.
Okay.
So maybe 5 days.
Sure.
But I think it was about 4 to 5 days.
Okay. And then do you remember, because obviously at some point you had a port placed,
Yes.
didn't you, an intravenous
Yes.
port, and do you remember when that first was discussed?
I remember having a conversation with you about options, and I think the way you shared with me not the risks associated with maintaining a PICC line, but there is a better, I don't know if better is the right word, but there's another option that is discreet and the access, is just as accessible. It's the longevity of it is once it's in, it can stay in.
Yeah.
You can shower freely, do all of these things very normally. So for me, there wasn't a lot of processing really that went on. It was like, no, that absolutely is what I need to do.
So did you have the port placed before you started the chemotherapy?
Yes,
You
I did.
Yeah.
I think it was probably 10 days, maybe 2 weeks before.
Sure. And so if we talk about the port insertion then, I suppose, so obviously I'm a nurse consultant in vascular access and I place ports in patients, and we do that in interventional radiology just because it's a little bit more safer and the environment is nice and clean and sterile. So do you remember the process of having your port fitted?
I remember having a conversation with you about options, and I think the way you shared with me not the risks associated with maintaining a PICC line, but there is a better, I don't know if better is the right word, but there's another option that is discreet and the access, is just as accessible. It's the longevity of it is once it's in, it can day in.
Yeah.
You know, you can shower freely, do all of these things very normally. So for me, there wasn't a lot of processing really that went on. It was like, no, that absolutely is what I need to do. I was given some advice around having a little bit of sedation.
Yeah.
So I think we discussed that, and it was an option. And for me, having a little bit of sedation on board whilst you place the device really was beneficial to me for my journey. So I don't remember any discomfort or pain. I remember some pushing and feeling of sort of like pushing where you were placing the port. I think it was maybe 40 minutes, half an hour I was on the table. But it was a very, I want to say, a simple procedure, as in it was it didn't feel as if it sort of intruded in anything that I was doing later that day. Yeah. Once it was fitted, I remember some sort of like the care around it, and access to your team and yourself if there were any complications in that first stage. But I wasn't worried about it in any way. But I'm glad I had the tiny bit of sedation.
Yeah, just took the edge off.
Yes.
The anxiety, probably, the unknown.
Yeah.
So overall, your experience of having the chemotherapy the second time through your port was? So
different, day and night, Andrew. The anxiety, the pain, discomfort, worry was all removed by having my port there.
Brilliant. It probably not something that we've spoken about before, but what's your perception now of vascular access and having that vascular access service there in the hospital?
I think when you're a patient and you are faced with many things that you don't really want to be faced with, for me, it's brought about a feeling of safety, physically, psychologically, emotionally. It changed everything.
So obviously you've had experience now of quite a lot of different types of vascular access. Peripheral cannulation, which obviously is a trigger for you with anxiety of your previous experiences. Have you had cannulation with ultrasound?
Yes. So I think there's been, I remember, I think there was one time on the ward when I've had it done, and that was for deep access. And then I think once prior to a CT scan, I remember coming into your department and having it done as well. And again, the experience was amazing.
Before the port?
Yes.
Yes, okay, brilliant. And so overall, how do you feel now in general? Are you well?
Yeah, I'm well.
Yeah.
If I think to my journey around related to chemotherapy and just the whole anxiety around it, I think I probably would have stopped my chemotherapy if I'm really honest with myself. Having to have it every 2 weeks and not having a port in, I don't think I would have had my chemotherapy.
No. Wow. The final thought then for you in your journey through vascular access over your treatment. Any final thoughts around that?
It's been incredibly positive experience from poor experience in my first sort of when I had breast cancer to the journey now. It is day and night. It's I think it's something that every patient that potentially needs chemotherapy or chronic illness and needs care around drug delivery with poor veins should have access to.
So I really want to thank you for today and for speaking to me and sharing your story. And yeah, good luck and thank you.